It is time for our weekly segment, Patel It Like It Is, where ABC News contributor Dr. Alok Patel shares health advice on the topics that matter most to you. Today, he's answering some of your questions. So let's start with Heather from Oakland, California. Dr. Patel, Heather wants to know, should people keep Narcan just in case, and what should you do after you administer it?
Timely question, Heather, given that it was just National Fentanyl Awareness Day. So check this out. According to the CDC, in all opioid deaths, and about 40% of the time there was a bystander involved, and in 2021, there were 80,000 opioid overdoses. So it is a very good idea for anyone out there who is at an increased risk of opioid overdose, whether that is from having substance use disorder, if you have a prescription, if you live or work with anyone like this, if you are with a high-risk population, to get some Naloxone. You can get these at a pharmacy over the counter, be more widely available this summer. But Diane, here's a quick overview of what you should do if you suspect an opioid overdose. The very first thing that everyone walking this planet should know are the signs of an overdose. So it could be slow breathing, no breathing at all, loss of consciousness, blue skin from having low oxygen. Call 911 immediately and then administer Naloxone, which may come in different brands. It's very, very easy to use. It simply goes right up a nose in many cases. And then you want to stay with the person and wait for emergency services to arrive. And, you know, the numbers speak volumes. You can absolutely save a life.
Andy wants to know if you can chat about vasectomies versus tubes tied. Maybe they're having a debate at home. I'm not sure, but break it down for us, Dr. Patel.
They may be. And Andy, I like this broad question. Let's try to see if we can do this in 90 seconds or less. So basically, these are two forms of permanent birth control. Talking first about male biology, a vasectomy refers to cutting the tube that carries sperm. No pregnancy. And when we say tubes tied, we're referring to a tubal ligation. Tubal referring to the fallopian tubes, which was what carries eggs from the ovary or where sperm travels up to meet the egg. And ligation refers to cutting, tying, or sealing off that tube. Now, as I mentioned, these are the two forms of permanent birth control, meaning they're 99% effective, but there are some factors to take into account. When it comes to a vasectomy, that's the one that's done with male reproductive organs. That is cheaper, usually faster. It can be done in an outpatient or clinical setting. You're going home the same day, less complications. With tubal ligations, that is usually a more invasive procedure. It can be done during a C-section, and there are some specific situations, such as in particular people with a higher risk of ovarian cancer, where it may actually be recommended. But a lot of people just say, hey, the vasectomy is a cheaper, faster, less complicated way to go if you're looking for permanent birth control.
All right. And Teresa wants to know, what type of pain or symptoms can people expect 1 year after a joint replacement?
This question is a big one. My dad loves to say that he can dance really well because of his bionic knees. Now, in general, 1 year after a total joint replacement, whether that is a hip or knee, which about 1 million are done a year, a lot of people shouldn't have any symptoms at all, no pain. But we do have surveys, including reports from the American Academy of Orthopedic Surgeons, that about 20% of people may have some type of stiffness or pain, but 90% 1 year later say they have great function and mobility. And it all comes down to your own individual situation, your rehab, activity modification, and following up with your doctor. Phenomenal procedure and surgery that still fascinates me.
So your dad likes to dance. What a surprise. Dr. Patel, always great to have you. Thank you very much. You can cut a rug, and now we know where you get it from. And if you have questions for Dr. Patel, we do this every Friday, so leave him a message on our Instagram feed, and he might answer your question right here on the air.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.